So let's look at some of the ones that are out there. Now, overall, much less studies have been done looking at bone marrow than PRP, but there's 2 level 3 studies and 1 level 2 studies looking at clinical outcomes in terms of knee osteoarthritis with 1 to 2 year follow-up showing significant improvement in VAS and disability scores. And probably the thing that I think is the most interesting about bone marrow, and the thing that I use it a lot for, are intraosseous injections. And that's in part because of some great literature that came out about a year ago. This was a prospective study with a 15-year rate of follow-up that took a look at patients with advanced knee osteoarthritis who were candidates for knee replacements. Half of them got intra-articular bone marrow concentrate, and the other half got intraosseous bone marrow concentrate into the side of the knee that was arthritic. And what it found was that after 15 years, the patients who got the articular injections, 30% of them, 70% of them progressed to a knee replacement, whereas 15 years later, only 20% of the patients who got the intraosseous injections progressed to a knee replacement. There was another study that came out about the same time, which was very interesting. So it took a look at patients, again, with advanced knee osteoarthritis in both knees. They had advanced medial knee osteoarthritis and bone marrow lesions. On one knee, they received a joint replacement. On the other knee, they had intraosseous injections with bone marrow concentrate. After 2 years, they got MRIs. A lot of the bone marrow lesions, these are pictures from the study, improved significantly. There was a range that they improved in a mean. And at 15-year follow-up, they had a similar rate of success. So 82% of the patients who got the injections intraosseously did not advance to another knee joint replacement. And I should say the ones that did, in that 18% group that failed at 15 years, the range was 5 to 15 years later, with an average of 10 years later progressing to a knee joint replacement. The overall incidence of a joint replacement after the bone marrow concentration injections was 1.19%, which was equivalent to the risk of a revision for the primary joint replacement in the contralateral knee in the same patient population. Some things that indicated they were more likely to continue to persist and get a knee replacement were that they had these lesions that were larger than 3 centimeters cubed. They had severe knee malalignment as well. Okay, so in terms of our evidence pyramid for bone marrow concentrate for osteoarthritis, we've got level 2 to 3 evidence that it can substantially delay knee replacements for the long term, and that it can improve clinically patients.